All right, so before we start talking about the various approach, all right, or various investigations, various laboratory tests you can do for a patient that actually came to the clinic and complained for stomach pain, we just want to do an introduction, to the whole concept of stomach pain. That's the acute abdomen that we'll discuss in surgery. All right. So this acute abdomen, the term just refers to what? A sudden onset of severe abdominal pain. All right. Abdominal pain and is so much severe, So it typically requires urgent medical evaluation and in many cases surgical intervention. So it's a clinical syndrome rather than a specific thing. When you see somebody having severe abdominal pain, there are 100 things that could be wrong, So it's just something that will now prompt you to do a deeper digging, to actually pick up what is wrong. So it can signal a wide range of underlying condition. So key features is the abdominal pain is starting rapidly, within 24 hours. The patient is thrown in a state of confusion and all of that. Pain may be localized just in one place where the patient can actually point for you, or is diffuse. It's frequently associated with nausea, vomiting, fever, pain, and changes in bowel habits. May present with signs of shock or peritonitis, right? Guarding rigidity and all of that. So common causes, you can have surgical causes, you can also have medical causes. So for surgical ones, these are things that basically you can treat them with surgery and all. So appendicitis, bowel obstruction, perforated ulcer, diverticulitis, strangulated hernia, ruptured ectopic pregnancy, acute cholecystitis, and pancreatitis. All right. Then you can have the medical causes. This one is just something that you can actually approach with using. You can approach it so you can approach it with medicines and all. So diabetic ketoacidosis, myocardial infarction, pyelonephritis, gastroenteritis, then sickle cell crisis. All right. So diagnosis is just history, physical examination, laboratory tests where they do complete blood count, C-reactive proteins, liver enzymes, and amylase. Okay. Then human coronary gonadal trophy in women, urinalysis. Then they can also do imaging if you are suspecting that this thing is actually from an organ that is from the inside, So ultrasound for gallbladder, kidneys, gynecological issues, right? CT scans, also X-rays. All of this might help you pick up maybe a problem from the abdomen or so, So initial principles is basically you have to stabilize the patient. So ABCDE of resuscitation, airways, breathing, circulation, So kneel by mouth until diagnosis is confirmed. Surgical consultation if red flags or imaging suggest a surgical cause. Definitive treatment depend on the underlying diagnosis, which may be surgical or medications or medical.